No? Yeah. Okay, welcome back. Now we start this second session, or the continuation of the first session, to discuss societal, scientific, and economic impact on EOSC. The chair of the previous session announced a fully female panel. I'm sorry to disappoint you, but but I won't intervene in the panel, I promise, so it can stay true. Yeah, my name is Javier López Albacete. I work at the EOSC team in the European Commission, and I'm very happy to contribute to this discussion. So first of all, like in every other session, I will remind you, how does it go here? The big button. Yeah, okay, this is the session we are in. Now, yeah, very important for all of you in the room, but also for those that are joining online, to use the Slido for your comments, for your votes, what are the questions that you like the most, and yeah, be bold. I mean, we are here for discussing, for poking each other, to stimulating our thoughts, and so I very much invite you to actually go and fill it in. Now we are going to have two presentations that are complementary to the topics that were covered in the first session. The topic of impact is very broad. There is the scientific dimension, there is the societal dimension, there is the economic dimension, so it actually deserves at least 2 sessions or probably more. Now, the very first presentation is going to be by Natalia Manola. She is well-known in the community, CEO of OpenAire, and she's going to be presenting on behalf of the Pathos project. Pathos is a EU-funded project. You can come in while I finish your introduction if you want. And they have actually made the understanding of impact of open science the core subject of the project. So, and understanding how to measure it, how to identify it, how to quantify it. So it's a very broad, all-encompassing, if you want, all the aspects of impact that they are looking into. And so please, Natalia, we are looking forward to hear from you. Come on stage. These buttons take you forward.
Okay, thank you. Hello, everyone, and thank you for the invitation. So what I'm going to be presenting is the Pathos project. I'm here to substitute my colleague Ioana Gripari, who is the coordinator of the project. And I have to just correct you a bit, because Pathos is about impact of open science, but mainly impact of science, but mainly of gauging the impact of open science. So I will say a few things. So, open science, we are all here because we're in EOSC, so open science is in our core business. We promise academic, societal, and economic benefits in general, okay? But what are the plans that we have put in place at institutional level, at a member state level, at individual level, and at European level? So we have all our plans, and we need to see how they're working. Now, I got some numbers from the EOSC Observatory that it was mentioned this morning. I know that Karel presented, quite a few numbers because we don't have those individual institution numbers. But what we need to say as a fact is that Europe is spending a lot of money on EOSC and open science, okay? So these are the investments, what are the expectations, and what are the returns that, the expected outcomes. So what we need to understand that there is the impact of science and there is the impact of open science, okay? So, and this impact may be quantitative, we can measure it like citations, but then there is this intangible impact that open science, we know is changing, for example, the way that we're doing things, and we need to measure it. So then, everyone is investing in a different way. Repositories in countries, Diamond Open Access, cloud computing, AI. So are we investing in each and every one of us in the right instruments to truly realize the promise? Are we achieving what are we expecting? Because have we set up expectations, or did we just invest in order to do open science like everyone has? And what are the enablers? So, if something has worked in one institution or in one country and has really enabled some impact, how can we identify them, and how can we, perhaps copy them or, adopt them? And then last but not least is, how do we measure this? There is monitoring, so we have this EOSC Observatory, we have the UNESCO Observatory of Open Science, we have the survey of the EOSC Association, so we are monitoring them. But, how do we actually measure? And then how can we attribute this science versus open science? So, how can we attribute the impact of the investment of $500 million, or as Carol said, of $1 billion to open science? So this is what Pathos is about. So Pathos is about to identify and quantify the key impact pathways of open science. And I will come back and say why the pathways. I will show you a nice diagram to show the different pathways. And then we're talking about across academia, society, and economy. And what do we do as a project? We are a wide area project, so it's like a big study project. So we map the causal pathways, and I will talk about the causal pathways, is to see what is the cause and what is the effect. And here, we are talking about the open science journey. So we design and estimate open science impact indicators for selected case studies because, the world of science is huge. And we use for the first time, or in a way that we can all agree to, AI-assisted methodology, big data. And then last but not least, I will not go into that because the next speaker, Despina, will go this, is that we want to formulate a cost-benefit analysis framework for open science. So if I'm an institution or if I'm an organization of any type and I want to have, what is my cost and what is my benefit, so we are in the process of getting this framework in place. Now, this is the usual, slide about the consortium. So what I have to say here, that we are a mix of open science experts, a mix of research infrastructures and national infrastructures, and 3 consulting companies. So we have a very good mix in this consortium to say, how we are going forward. Now, our methodology, of course, we have our theoretical background and everything, but we are based on investigative case studies. The 2 first ones will be presented by Despina, the bioinformatics and the COVID-19. I will present a bit about the emerging topics, and then we have 2 national cases, one in France and one in Portugal. Why did we pick them? Because they have very good infrastructure on open science, and I will say a few things. And then, of course, the Netherlands as the EASY, which has a national data repository. So we have picked these cases in order to help us come from the enablers, what have they done, and what is the impact, okay? What are the key outputs? Okay, though this is a big slide, so I'm not gonna go over it, but the key outputs of the project, and they are mainly a handbook of open science impact indicators and the methodology on how to derive them. We have the frameworks, 2 frameworks, the open science pathways, which is, it's going to start from the enabler and the way to the impact, and the cost-benefit analysis. And then, of course, we are doing the literature insights and registry I will present, case study deep dives, training and engagement. We are now in the process of drafting a training program for policymakers. Some intermediary results, because this is work in progress. Literature review. Our team went over 725 scientific papers, went over them, read them, did the marking, some kind of very nice methodology. And what did they come up? Existing evidence for impact, okay. Now, if we talk about academic impact, what are the instruments? The instrument is open access, citizen science, open fair, but what is the impact? How do we measure the impact? And here you will see the usual suspects, citations, efficiency and productivity, but then, we start to see things about reproducibility, about ethics, about novelty. So we are starting to see that the scientific literature about impacts is talking about things that go much beyond your citation. And this is your academic impact as an individual or as an organization. Now, if you think about societal impact, what we know about societal impact is, are the mechanisms that drive the public participation, the collaborative creation of data, and the uptake and stakeholder engagement, okay? The instruments are the usual suspects, which is the citizen science and open access, open data. But then, if you think about, what is the impact, we see, participation in policy or contribution to policies, in health, in climate. All of this is very much related to science. And of course, our goal is translated to what is the impact of open science. Now, on the economic impact, this is where it's the most tough part, because, science, we know that it has, how should I say it? It has an impact on economy, but it may be long-term impact, okay? So something that, we are going to do now may have an effect in economy, from research to market a very long time. And this is very, very hard to grasp. So we are going around to see, the problems that we say is that, we have many theoretical papers. Again, I'm in the literature review now, but few with real evidence. So, people write, their ideas, but no data. Most papers are on citizen science and open data. Most evidence comes from medical and biotech sector. And if I have to make an interpretation of that, I would say that, very naively, because I was in the bioinformatics in the 90s, is why? Because the bioinformatics sector opened up data from the 80s and 90s. So what we see now in the economic evidence is, first of all, it's something that affects the health of all of us. And then the second is that we see the result 30 to 40 years after, 40, well, almost 40. Now, the challenges of implications, I'm not going to go for that, but what is hard when we're doing the literature review is this the streetlight effect, is that, we find what we're looking for, okay? We go under the streetlight and, we find things that we want. And that is a problem. So this existing evidence of economic impact, we need to further work on that. And as I said, is that this literature review has led to this kind of complex diagrams. Does it have a significance here? Probably not, because this is work in progress and we're working to see how we will present it. But it shows you the different pathways from just open data. If we open up open research data, what are the possible ramifications and the impact in all of this? Now, how can we quantify impact, indicators, and causality? Okay, indicators. At state-of-the-art indicators, what we know is that academic indicators, I think we're good at that. We have the citations, we have the peer review, we have all of these indicators that, people feel comfortable in using. When open science comes in, I think we can capture good enough practices, especially the results, the outcomes of indicators. But what we are missing is training and policies that, we need to have better indicators. Then reproducibility is hard to measure. We're talking about reproducibility, replicability, and reusability. So now I think we are trying to see reusability, okay, and then, to move forward. So we are collaborating with the Tier 2 projects on that. And then, of course, the societal and economic impact is that we don't have many developed and harder to measure. We don't have many indicators. And if you are proposal writers for the European Commission that they are looking for these KPIs on societal and environmental and economic impact, all of you would probably have faced the challenge of writing what is going to be, what is the actual impact. Now, for that, we have the indicator handbook that we use proxies. So we have a long list. If you go, I don't think I put the link there, but you can go to the Pathos project site and look at it. We have the academic impact, for example, readership. Open science and the readership, where does it come from? I will give you an example. Collaboration, interdisciplinary. Those are things that we are measuring because they have started, apart from excellence that everyone used as the citation counts as part of an excellence. Now we have more aspects where we judge the academic impact. We have the societal impact, uptake, for example, by policymaker, by patient groups in education and stuff like that. We have the economic impact, so we're looking at collaboration with private-public partnerships, labor market of OS, cost savings and all of that. And then last but not least, we are starting to looking at the reproducibility impact. What we face now, because as we said, we have science and impact, okay? Now we have the impact of open science, okay? So what we need to see is to have the whole thing of science, to see to get the open science part and see what is the actual impact. So we are looking for causality here. And what we know, and we knew when we wrote the proposal, and also it has been verified, but by everything we do, is that we have complex relationships, because we know this is research and innovation is a complex environment. So it doesn't mean that it's a complex system. So not one pathway or not one kind of relationship allows you to do this causality. So we have example of confounding factors. For example, increased collaboration after data policies could also be due to more funding or training or complicating, the attribution. So it's not just about a policy, but it's because I did a policy and I had 2 people installed in my institution to train, and do all of these things. And this is the challenge here. Now, we have 2 case studies. I will go very, very quickly over them. One case study is the French open science infrastructure. Why, did we study that? Because they have for years, they have Open Edition, they have HAL, and now they have the data repository. What we are looking for there is I would say the access log. So we are looking at the readership, and we focus on, who is reading, who accesses what, and from where, okay? And what we have found is that if you see the uptake of the enterprises, okay, you will see that, even though there are some social sciences or humanities things, okay, they are read by companies. So this is a work in progress. It shows, different sectors, for example, bank, aviation, media, for social sciences, and the number of times that they are read. The second case study is what we're trying to find is the emerging AI trends in climate change. So here is interdisciplinarity by its design, okay? So what are we trying to find? We're trying to find the impact on innovation to assess how the different open access routes influence the development, and then also the gender analysis, how many of these AI emerging, influencing climate change, what do the women authors have to do with it, okay? And how do we do it? We do it with big data. This is where the big data and the AI analysis is. So what we have is the open-air graph, which has 180 million publications and 4 million projects. And we have PATSTAT, which is 200 million records, okay? What do we do is we have all of this data, and I will try to explain maybe in these 2 mails. So, for example, we can have causality insights, we have transparency, just because we are using open data, and we produce open data, and the tools and methodologies are open, okay? So this is what transparency. But what do we do? First of all, is we establish causality just because of the sheer number of data that we have. When you have 180 million publications, 200 million patents, okay, then you're able to build your control groups, okay, to make meaningful comparisons, okay, accounting for open access routes. So what if, then else, or, what if this did not happen, or if I have this control and I didn't have. Being able to play with such big data allows us to have different control groups and to make sure that, we have this attribution and causality. Now, because in the open-air graph and also linked to PathStat, we're able to capture the provenance and the journey, is we are able to have rich pathway analysis at every step, okay? Then, so we have end-to-end research journey from funding to publication, from citation to technological innovation. And why are we able to do that? Because we have AI deep learning algorithms in order to extract technologies at TRL, which TRL levels at the publications, and then see how this translates to patent. And also, you know, some other work that we are doing in other projects is also how does the company that does the, you know, companies are adopting this patent or non-patent. And we're talking about green or digital. So this is where EOS comes into this, you know, into feeding all this fair data into us. And of course, is we're able to assess quality and diversity, okay? Now, last slide is pathos moving forward. So what we are in the middle or somewhere in the middle. So what we need to do is turn these open science indicators into causal indicators. And then, you know, have these causality narratives for all case studies. We have the 6 case studies, so we are doing this. And then, of course, what we need to do is to deliver the cost-benefit analysis methodology that Despina is talking about. What we would like you is to engage with us. So we are now starting to draft a training program for policymakers and research administrators. So you will be able to sign up. We have the Pathos Handbook, so we would like feedback, you know, online feedback from you. And also, you know, you can share, and I think, you know, we can do it with EOS Track, your, you know, a story. If you have a story, we would really need to hear from that. And this was about it. Apologies for the extra time. And,
yeah. Thank you very much, Natalia, for the very interesting presentation of the activities of Pathos. It's certainly challenging the problem that you have at hand. I already have a question for later. I look at the Crédit Mutuel is the main user of the French open data. I mean, that is what you showed in one of the slides. I was left think is the main client of an open access repository. We can maybe go to that later. But now let me invite Despina Susoni from Elixir Hub and also part of the Pathos project. She's going to guide us. Please come on stage. In detail through one of the use cases of the Pathos projects that has to do with the uptake by industry of some of the results and resources available in the COVID-19 data platform. So, stage is yours. Thank you very much.
Yeah, this is me. Hello, everyone, and thank you, the organizers, for inviting me. What I'm going to talk to you about is the industry value of infectious disease open data. So just to say that I am the Industry and Innovation Officer. Recently, the impact portfolio has also been added in my role. It's coming natural to me because of my previous work in the Commission and UNESCO on open science, and also I've learned a lot through the Pathos project that was already presented. A lot of knowledge and expertise have enriched the Elixir capacity, and we're lucky to use this expertise in an EOSC project that is called By COVID, and what I'm going to talk to you about is the industry value of the infectious disease open data. So what is Elixir? A bit of a background in case you don't know. We are a distributed research infrastructure of bioinformatics. So everything is in the open access domain. We are digital, so the only limitation that you have is actually your internet connection. So in order to make sure we keep doing the things like this, we have to convince our funders that our work matters. And for that, we have created a dashboard, which is online, and we feed this dashboard every month with data. Data like publications, Elixir-supported publications, and how much they are cited, patents that they are referenced, the Elixir resources, the work that we do with different stakeholders, and how big our core data resources are, and how much they are cited. So, as Natalia mentioned, Pathos has been embedded in our Elixir practices. And as you see, we already had some impact knowledge. The thing that we thought to work in the Pathos project was our innovation from open research resources, that is Elixir. So we were not interested to see if we are used. We know that we are used. The question that we wanted to solve there is how and what impact we have on innovation. So for that, the if we are used was answered a few years before when we do some surveys and interviews with SMEs in the life sciences, specifically 50 of them. From these, 76% of them said that they couldn't provide their services or products if they were not accessing data from open repositories. Keep in mind, these are in life sciences. So we thought, great, we had already some data. Let's do this for COVID, and specifically for ByCovid. So just to say, the ByCovid is the project behind the COVID-19 data portal. It was an EOS project because it finished in the end of September. And what was this portal was doing, bringing together different life sciences data repositories and social data repositories, extracting all the information related to COVID. So we built a kind of a common knowledge on the virus. And all this was open for everyone to use. My part of this project was to understand the industry value, so how these COVID data have been used in industry and what was their role in innovation. And there is a third aim there, which was during the procedure, which was a quite hard procedure, as I'm going to say next, we thought a new aim is to give visibility actually to these companies that they are knowledge, they open biodata resources, because it's not something that comes natural to industry. They don't have any mandate to reference where do they find the data except of credibility. So we thought it's also very important to make sure that we give visibility to these good practices when they do acknowledge open biodata resources usage. So on the top of this challenge, companies were already not practicing the referencing of open biodata resources, so it's hard to know if we are used. On the top of that, of course, the end of the pandemic came, thank God, in 2022, and actually companies were moving to a new challenge, which we talked even before, AI, machine learning, LLMs, so less of an interest to engage with us on infectious diseases. So we pivoted our approach and we followed a more desktop research analysis on patents and publications, and for that we use the Pathos knowledge and expertise. And I'm going to talk to you through the different findings that we had. So first of all, which are these biodata resources that they were used in patents? You see here in the x-axis 14 different biodata resources of the COVID-19 data portal. If you're not in life sciences, maybe this don't mean a lot to you, but it shows actually some of the most popular ones coming up in patents. And worth mentioning here that we just looked at the reference of the database, not at the data that they are within these databases. We know that the data within these databases, they are very popular, but just I wanted to say these are what we looked at, found actually in these 1,000, more than 1,000 patents. In this list of patents, just here worth mentioning that we looked at patents in less.org, is an open patent database, which is behind TransPatstat that was Natalia mentioning before. And also in the bottom of the slide, you can see how many of them, they reference more than one of these resources. So in this case, 2 or 3. And in pink, you can see some very popular one. Uniprotein ensemble, for instance, is a sign that they reference together in patents, some patents. So next, what are these patents? We looked at how many of them are active. Active means the invention is validated and the owner has the exclusive right to sell the invention. Most of them are pending, so the invention is not fully validated yet. We looked at citations. I put here the 2 more cited patents from this list. Citations is important because it shows that the patent, the invention has an impact in other inventions. So in this case, we have 54 and 53 citations. The one is referring Uniprot, the other Ensemble, and the last column you see the company Novavax INC and the 10x Genomics INC. Then, as you see, companies are behind these patents. So how many of these patents they had an industry applicant in the back? 26% of them they did. And who are these companies? So we move even more deep. 122 companies. Unfortunately, the most of them, they don't have their headquarters in Europe, but keep in mind that usually most of these companies, they do have some workforce in Europe, or even some of their departments are in Europe. They are in the small and medium enterprise size, and they are more in pharma and biotech, which was something that we knew already, but it's validated. Interestingly, we found some in technology and AI, like Hewlett-Packard and another one in AI. We also wanted to see how many in this patent list, how many companies, they own more than one patent. So the way that this works, companies will go and keep patenting in a very niche area that they think they create a competitive advantage. So in this case, we found that 50% of these companies, they have more than one patent in these certs. You see here, some of them, they have up to 13 or 12 patents. For instance, BioNTech is one of the companies, one of the few and successful companies that they discovered the RNA vaccine. So what that shows us that in order to create a competitive advantage, partially these companies, they may rely in open biodata resources. We also looked at publications, scientific articles. In this case, we didn't look at the databases that I mentioned before for patents. We looked at the portal itself. Again, we know that the databases, they have been referenced a lot and the data inside these resources, but here we only focus on the portal. 363 articles were found to reference the portal. 17 of them, they have an company affiliated in the back. I put here one of them, which is the most cited, actually, publication with 3 different companies in their affiliated institute. Keep in mind that there are a lot of authors in this publication, so it's not saying something specific for these companies. With 255 authors, some of them, yes, they were from industry, but interestingly how the portal is mentioned as a great example of international collaboration for building infrastructure for a global approach. So to finish up this presentation, I thought mentioning again the Pathos project and inspire you a little bit of what you can learn from this project, and specifically on the CBA cost-benefit analysis work that we do for one of the very popular Elixir resources, Uniprot. And for that, I'm going to present you some preliminary results. The whole report for this work will be in the beginning of 2025, and the whole project finishes in September 2025. So this is a very high season for us. So from this survey, I extracted the findings that we had for the industry answers. I'm not going through all of them, but I will stop here because it's something that we already knew. The industry products that they rely on open data, they actually rely in a pool of data, among which some of them are open data. So Uniprot, for instance, despite that is a very popular resource, it is just one of the many that the industry responders rely. A difficult part for the cost-benefit analysis is the willingness to pay, so that will give a value to the resource. But, and as an alternative to this, it's always a scenario, what if Uniprot in this case was not existing? So for this, the industry answers, they said that they will probably exist another open science resource, maybe in lower quality. And overall, they do believe that they will still achieve their research outcomes, maybe in a less good quality, more time consuming to find the information that they wanted, maybe more expensive. So yeah, UniProt values a lot to them. So as an overall conclusions, what we have found, and I hope I convince you with this presentation, is that the open biodata resources are well integrated in the R&D and different industrial sectors, and we saw that through the COVID patterns. And the second bullet that I've put there as a message through all the work that we've done with interviews talking to companies is that if a resource is well integrated in academic practices, then it will be also integrated in industrial practices. I put also the link of the by COVID report. As I said, the project finishes in September, and also the QR code and some useful resources that help through this work. And the handbook of indicators link is also there that Natalia, I think she also had in her presentation. And last, my favorite publication, which compares data research infrastructures and road research infrastructures. It helped me a lot when communicate to people to see how people understand data infrastructures versus road infrastructures. And with that, thank you for your attention and look forward for your questions.
Thank you very much, Despina, for a very interesting, very concrete presentation. And now I would like to welcome Natalia on stage for a panel discussion, and also Ilaria Nardello from the EOSC Association. Thank you. Well, first of all, I would like Ilaria to quickly share with all of us a little bit her reflections on the topic of the session, since you didn't have a chance to make a presentation. So a brief statement on what interests you the most, or what you think, how are you thinking about this topic of impact?
Thanks. I think the presentations were excellent. The topic is certainly immense, to say the least. And I look forward to following the Pathos project and its development, maybe the training, because certainly they're moving into the direction of really achieving now the implementation of EOSC. We want to see, we want to quantify what this will lead to in terms of really impacting on society, science, etc. So that, for me, is certainly something that I follow closely. For the presentation of the Despina, I have questions, because what I'm thinking is that, of course, your data are very interesting. For one thing, they're data. So you interviewed people, you've searched the results, the impact, the patents, the licenses, how your resources actually led to some achievements in industry. And I was wondering if you had any idea, or if you did partition perhaps the information in terms of size of industry, because we know that innovation happens at the micro level. In smaller enterprises, it's easier to consolidate innovation that then will be passed on to the next level. And I was wondering if you did have that information, or if you want to look into that to see if the micro enterprises could be, in fact, more involved, or if you could find a way to link that the use of your resources is really important for them. Because I think it was even Mario Draghi who said that Europe is somewhat killing the smaller enterprises with bureaucracy and our own rules. And open science, open data, open information could be something that brings this, removes a barrier. And so in that respect, this information could be interesting.
Thank you very much. Do you hear me? Yeah. For this question, I think we didn't look, as you saw in one of the tables, I put the SMEs, as being the one that actually had the most patents, because, I don't know, people think that maybe it's all about the large enterprises, and it's not. It's the smaller, actually, the company. And a lot of the patents were from academia, right? So we should not forget that maybe some of these are going to be spin-offs. Yeah. So it's not something that we looked, but I think we know that this is happening. Yeah. But yeah, we don't have the proof of the data. But what I would say, it's something that I think I removed to not complicate the things. It's coming from the pathos work and the cost-benefit analysis, where we categorize companies, the answers of the survey based on the size. And there, very interestingly, came up that the micro enterprises, they were stating that they couldn't do the work without Uniprot in that case. So while all the other sizes, they were saying, yeah, we'll manage somehow. Exactly. The micro were quite definite, and it's very clear that they were saying we wouldn't even exist. Right. So that I hope answers your question.
Yeah, it does. Great, thanks.
Well, no, if you want to compliment, this was a good interview. You want to?
No, I just want to compliment to say that patents is just one small, very, very small, because about 2% of innovation is patented, okay? And especially when we talk about AI now, it's not easy to patent. So we're talking about patents, and we're talking about companies that somehow publish, which is not very seldom, okay? So that is just an indicator, even if it's a small indicator and the numbers that you have produces 300 or 1,000, we should expect that this is just a proxy indicator and the actual number is much more, okay? That's the hard part of the economic, of addressing the economic impact.
Maybe worth adding something on that?
Yeah, sure. I wanted to open for questions from the room, but you have it going. So
until you sing your question.
Please raise your hand if you want to intervene, make it the conversation as open as possible. You are all welcome to do that.
I completely agree with Natalia, and what we are trying in Elixir a lot is interviews, contacting the companies, talking to them, understanding what they need, rather than do the work that I presented in by COVID. I think I mentioned very shortly that it was because it was very hard to talk to companies on the topic while so many other things were happening just after the pandemic, after 2022.
Okay, there are questions from the floor. Sarah, here, microphone here, please.
Thanks a lot for the presentations. I found them very interesting. I have a question because so when you try to define KPIs, and even if you're able to quantify them, usually the question is, are these numbers good or not? Because usually you cannot really compare, you don't know what to compare with. How are you approaching this problem?
So as I said, is that there are different ways. When we talk about academic impact, I think we are okay in that, okay, because we have the measures and citations and some other indexes that we feel comfortable with, even though we know that sometimes the system there is a lot of gaming in the system, but still they're good indicators. So when you talk though about societal and economic impacts, that's the key. So in societal impact, we can start, and I think this is the Pathos Handbook, which is good for. It tells you about all of these proxy indicators. It tells you about how you can measure them and then how you can interpret them, okay? And then what you need to do is you need to put it in the context. So for example, Elixir. Is it more successful than NCBI? We don't know, right? I'm sorry for that. Is Copernicus, is more successful than the equivalent NASA project? Because this is what we talk about open data. I think, at some point is that you need to see that you are successful and you have an impact. Okay. Now, if it's more impact than your neighbor, let's say, you know, if it's an institution, a country or a region, then it becomes more difficult, and then you can only have studies with what Despina said, focus groups and interviews all over the world. And I think, you know, this is the best you can do. But on the other hand, if you have, as I explained, you know, open air graph with open lens, SpatStat, you have crawling of companies, you can do a lot of wonders as long as, you know, you have the computing power to do, because the more the data that you have, you can set control groups and you can start having comparisons, okay? And you can play with scenarios. So I'm not sure if I have responded exactly to your question, but I think, you know, this is the best that you can do at this point in time.
I can add, maybe elaborate a bit on this, since we're sharing this burden to monitor. And so indicators are, of course, at the basis of our exercise of monitoring what happens, whether it is impact or something else. I believe that indicators should be set in a way that makes them reliable. When you find a result of your monitoring activity, your indicators should be sufficiently reliable that you can do something with the information that you leverage. And in this respect, I'd rather go with a small number of indicators on which you can rely on to describe a situation, rather than to try to get a lot of information out of which you may not find a way to narrate a story. I do agree with Natalia that in some cases indicators, or let's say situations, may be so complex that an indicator may be very difficult to pin down, or you may need a suite of indicators, and this becomes, you know, a very difficult exercise to then have a monitoring framework for a certain situation, like it could be impact, which is too broad. I agree that in that case, primary information coming from interviews could be a way into assessing the situation. Even then, I think it's very good to have really interviews one-to-one, where you can really talk to a person and drive the conversation and drive the answers, not in the sense of getting what you want, but really guiding the interviewee into responding along the lines that you want to investigate. Because sometimes we have these open questions in our surveys, and the information that we receive there is, you know, it's really hard to make sense, and especially it is really hard to make sense out of a pool of answers along the same question.
Especially across Europe, the diversity.
Exactly.
Maybe I can also mention that for me it's always sensitive, the comparison. I don't know, it's different fields. We are a research infrastructure, we have institutions, so I wouldn't dare to compare just because we are very different. So I would say each of us would find their own KPIs. In S3, for instance, as a research infrastructure, we have the European Forum, and it's very hard to answer the questions because it's like one solution fits all, which is not the case, and we know it in open science. So I would go more and ask the funders to think about the cost and benefit, not the cost-benefit analysis, but the cost and benefit. How much do they invest and where they would like to target? And then we can make some KPIs that make sense. It should be, as you said, very simple, and very targeted to what we can easily measure, because the hours that you can spend going deep in analysis and surveys and interviews is tremendous. So yeah, be careful.
So you want to pass the problem to the funders, to define the KPIs, and then you'll...
You know, finding the responsible person is always difficult.
Any more questions from the room? There is a question over here, please.
I think one thing that was clear from the Elixir presentation is when you know where you're looking for the impact, it's easier to find. So if you're looking in COVID patents for COVID-related impact, that's nice and easy. I'm representing the research infrastructure for structural biology, and the number of areas where we could have impact are so numerous, we find it a very difficult challenge to know where to look for those impacts. And we're almost certainly missing something. I really like Natalia's point about proxies. We can look at proxies, but we're probably going to miss an awful lot. And I wondered if you had any thoughts on that point.
Can you repeat the last question? If I had thoughts on what?
The use of proxies in contexts where the impact could be anywhere in such a widespread sphere.
Okay. I think we may be talking on different levels because, first of all is that when you set your KPIs and you're doing your proxies, okay, you need to know your objectives. Okay, so what are your objectives? Somebody, for example, can take open science, or you can have this, not because the European Commission said so, or not because my country minister said so. It's because I'm a research manager at an institution, and I see the possibility and to achieve 2 or 3 things, right? Okay. So first of all, you have to set the objectives. Then these proxy indicators, I think you need to translate them, you need to make them, okay, to construct them and translate them in a way that you can see if you are responding to your objectives. First of all, you can't really possibly say that by building an infrastructure like EBI, you're going to save, the world, right? You need to target on excellence, on collaboration, on then. And then, of course, it comes societal challenges, societal things. Then you see how you can measure that. Now they're talking about innovation uptake, okay? How is that? In the problem that we see is that, you need to have very good data. So you need to have very good data in order to see what are your databases, like Despina said, what are your facilities. And then when you have a facility, okay, and somebody is using that facility, for example, do they mention this facility? Do you require them to acknowledge the facility like the Commission or the other funder does when they give you money for the project? So this is the whole path that you have to set, and it's going to take a lot, many years to set in the right way the policies that you may start tracking, okay, for a few years, like what we're doing now in EOSC. In EOSC, we're tracking, we're monitoring, we're not assessing yet, okay, the impact. And then the impact. So think about a long-term impact. And I know that in ESFRI, for example, we are using the ESFRI infrastructures. You have all these KPIs, and you need to measure. Okay, I think you need to take it lightly, but make sure that you build, like Elixir did and Despina did with one of their reports using Pathos, is that they built their roadmap in order to understand these KPIs. So if I can finalize these, objectives, set up the infrastructure, set up the processes and the policies, start monitoring, and then assess. But this is a long way. I don't know if I have answered your question.
It's an interesting reflection, even if not. You wanted to add?
No, I actually think this is exactly what I would also advise. I mean, you need to really understand where you, as in your mission, want to have an impact, and then take it from there. Of course, you never know the effect that something could have from research on society or anything, but as far as you are concerned, you will have your mission. And this is what the impact regards your own sustainability plans, and that's what you need to measure.
Thank you, Ilaria. There is a question over there.
Thank you very much for the presentations. I was wondering, who's the target audience for impact? You said a lot of you, but this is like very high level, like EOS research infrastructures. but the research community is very heterogeneous and very wide. So who should be involved in impact measurement? And if so, can you comment on maybe training? So what kind of audiences may or may not need training on impact? And how to establish that? Maybe a multi-layer question, sorry for that.
I can start. That was one of the first things that I asked the impact officer before I get the position. That was one of my first questions. Why are we doing this? The easiest is the funders. So these are the people that they are interested to see these results. But what I've seen is also the users and also the management. So the users, because it's always nice to see when you are using something, who else is using it, and see the impact that overall this resource has, so you don't feel like, okay, I'm the weird one using this one. Because some of these that I saw, Uniprot is very popular, but some of them, they are not that popular. So it's always nice to say that, look how much this is used. And management, it's very strategic for the people that they are taking decisions in an organization to know how are we moving forward, what type of things we are having impact on, because affects putting some ideas, some visions there, building all these big words that organizations have about visions. I think all these are built based on some knowledge on the impact. And then for the training, I would pass for the pathos.
I would say that, if you are a research manager, okay, if you're managing research, or if you're a policymaker, you need to understand that as a policymaker at the institution or funding organization or ministry, you are designing policies to say, where should I spend this money, okay? So this is very important for them to understand that money can be spent on research infrastructures, for example, and, what are their expectations, and, what are the measures that they will enforce these research infrastructures to put in place in order to do this path. Then at the university or research manager, somebody is managing an organization, okay? And why are they managing this organization? Because they need excellence, okay? But what we need to agree now, this has been for a long time, is that research institutions have gone much beyond the excellence of research. They are looking at collaborations, they're looking at opening up to the public, they are looking at, to be more extrovert in any way possible, not just to bring money, but to have, a good visibility. So this is for research managers within institutions. But also, if I may say, and my colleague Thanasis is not there, we're running the Graspos project, which is about individuals also. So what is the impact and how do you report the impact of the individuals? And there is another WIDERA project called Opus that they are doing, a similar kind of way of assessing the impact and the practices of individuals and institutions. And so this is all connected, and where EOSC now is in place is that EOSC as the facilitator of data-intensive science, and as the facilitator of connecting institutions and everything together, we have the great opportunity to start recording all of this so we can assess the impact. And this is where, the big role of EOSC is here.
Thank you very much.
May I just add to this, somewhat also wrapping up on what you both said, but I think impact is also a great selling point for the funders or for the, let's say, the actors that perform the impact, that actually achieve impact. They have a great selling point to ask for funds, for example, support to continue their activities. And somehow it will be really also important because impact has this issue with long-term dimension, the time dimension of impact. Sometimes it could be short, sometimes it may be extremely long. I'm not sure, but maybe the Pathos project could, in these proxy indicators that they're setting, if the proxy being a proxy could be something that brings ahead in time. Okay. Yeah, think about it. It could be important.
Okay, so I am afraid that we need to close with the reflection. I still have the doubt of how Crédit Mutuel is the main user of open data or open resources in France, but maybe we can take that for the coffee. You can send me the numbers. I would like to thank you, the three of you, for your very interesting presentation and discussions, and all of you as well for your participation and attendance. Please.